So
Sure.
I'm Jason Corburn, professor in the Department of City and Regional Planning and the School of Public Health at UC Berkeley. I also direct a center there called the Center for Global Healthy Cities, where we do a lot of participatory action research with communities on health and healing. And I'm going to talk a little bit about one project. I'm actually not in Berkeley right now, even though my background may look like it. I am. I'm in Nairobi, Kenya, and also doing a community-based project there. Uh, and so some of the work, I'm going to go through this quickly. And there's probably going to be some things I'm going to leave out a lot from some of the stories. I'm going to focus on one community. I'm actually going to try to ground some of the concepts and ideas that we heard the keynote speaker raise. What does that look like in actual community health practice, research, evaluation, policy making, etc.? A lot of this has already been written about in articles that we've published in a book. Here you see on the screen, and just some resources for folks to follow to get more information about the cases and examples I'm about to give. So I'm going to emphasize that when we think about where are we moving in community health, we need to really engage with this notion of healing. We have often missed that communities experience much trauma and challenges, not just health outcomes, but the determinants, as we've talked about, the mental and physical health challenges, and that moving to a healthier community also often means recognizing those past challenges, healing from them, and moving forward in a healthier way. Particularly, we are concerned. We have an epidemic of urban gun violence in the United States. Some other countries do as well, and increasingly, even places like Sweden have had a rise in gun violence. And um, what we've tried to do is take lessons from community health and a public health approach and apply that to gun violence prevention. And I'm going to give some concrete examples of what that looks like and how that's a healing perspective, both place-based and people-based. And I think that's really one of the key lessons for our work that I would leave with you in community health is we need to focus simultaneously on people, places, and resulting and influencing policies that shape both of those opportunities. I'm going to transport you to the San Francisco Bay Area, where I am in Berkeley, California. This is a region of 9 million people, very diverse in terms of the population groups, the ecology, the economy, one of the richest regions in the world in Silicon Valley, and less than maybe 30 kilometers away to the north is a city called Richmond, California. There's a number of Richmonds in the United States, but this one is Richmond, California. It's a very rich history of industrialization, um, but it's also one of the most unequal places in California and the United States. And we have been working with the city and community partners for about 15, 17 years to try to turn that city around from what we call a toxic town to a healthier, more peaceful place. It's a place that has seen many refugees arrive and resettle for over a century, actually, in this community. Um, it also has a long history of industrialization and activism, community activism. One of the largest petrochemical refinery facilities and ports on the western part of the United States is located in this community. And when we first started, it was also the ninth most violent community in the United States, which ranked it in about the top 15 in the world. In terms of gun violence and homicides in particular, and part of that resulted in the lowest life expectancy in the region, again, about 20 years ago. And really, many commercial determinants of health, we didn't call it that then, but we are calling that now, including industrial pollution, workplace exploitation, and lack of access to the economy, particularly the formal economy, which leads people into the informal economy, lack of affordable housing, and particularly the access to firearms. And I'm going to argue that firearms are a commercial determinant of health, or the firearm industry, much like we think about tobacco, alcohol, sugar, and the petrochemical industries, all contributing to what we know is a form of structural violence and that toxic stress from that violence into our bodies, which adversely influences health outcomes. And this was really how we got started. Many partners here from the city to NGOs to health agencies and the University of California, Berkeley. Most of what we do is kind of work with community in a participatory way to capture actions and evaluate their impacts on both people and places. And again, one of our crises is urban gun violence, and there is no community in a violent place. People are afraid of the public life. They're afraid to go outside. They won't let their children go outside. Sleep is disrupted. Um, School performance, we know, suffers. Hypertension, fear, anxiety, all contributing to this kind of constant stress, this hypervigilance, and the stress hormones that constantly release that wear away at our immune system and our bodies, which is this notion of toxic stress. We also know, though, that social connection and supports can be an antidote to some of these stressors. They're not the only solution, but also changing our community built environments. Um, and that previous responses, particularly in places like the US and Latin America and South Africa, of increased militarization, policing, and incarceration, has really resulted in sort of racist segregation and removal of people from communities, dehumanizing them, and not led to health and healing. And again, guns and the firearm industry, in many ways, is a commercial determinant of health in our view. So how did we start? We started by working with community members and asking them, what do they want to change? What are the key drivers of stress and fear and unhealth, lack of health in their community? And we did a series of workshops in multiple languages. This was one example in the screen I'm showing here. These were women leaders to identify some of the stressors that they faced and to write these down. And we put that together into a vision to move forward with the city, with community-based organizations, NGOs, and built this into city policy making to try to identify stressors and how can we reduce the toxic stressors in the community, many linked here. And we use these kinds of visuals and graphics to really engage community members to become leaders in this change process. We also really looked at the literature and really framed some of this work as what we're calling, and others have called, neurourbanism, a concept that I think is more popular in Europe than in North America. But it's really saying that the traumas in communities and our urban built environments can contribute to that trauma, but so do social policies or lack thereof. And then we must change our living conditions and opportunity structures in, to enhance social connections with the aim of healing from this trauma. So neurourbanism is both an analytic approach to living environments and our communities, but also can be seen as also a strategy. What are the responses to these urban traumas, and how do we do this in an interdisciplinary way where we bring in insights everywhere from neuroscience to urban planning to community health? And the key insight really for change in this neurourbanism framework for us is the reality of this neuroplasticity. We can change our bodies and our brains and how they're wired, the stressors that adversely influence our brains by changing social conditions and changing the built environment. We didn't want to make this a clinical approach. We wanted to make this a community approach, even though we're using very clinical, somewhat technical terms here. And I'll give concrete examples of how we've been doing this in two cases from Richmond, California. So, like I said, Richmond has taken a long-term approach. I'm going to give you a summary in 15 minutes of or less of almost 20 years of work, ongoing work. The first insights into building a stress response strategy, a community health strategy, was into the city's general plan, which is the long-range development plan required by law for every municipality in California and most in the United States. Of how are you going to develop? How are you going to get energy, housing, all of these things? That shifted into eventually the city of Richmond being the first city in the United States to adopt a health and all policies strategy into its city law, meaning that every city department, every city agency has to meet health and health equity objectives, which were set by a community process, the one I just showed you, driven by this notion of reducing stressors and inequalities. And this is now contributing to a project called Richmond Rising, which is really integrating climate change and climate adaptation into all of this. I'm not going to get into all of this, but there's more information on the websites linked here. The first innovation and the healing approach in Richmond was to create the first in the United States Office of Peacemaking into city government. This was for us, a radical approach. This was to say, instead of public safety being the domain of the police or social workers or um, the military, hopefully not, or some other government agency that typically used weapons and violence to bring quote unquote peace or public safety, the city of Richmond took a very radical approach. They said, we're going to put peacemaking into city government, but not in the police department, in the mayor's office. And it's going to be right up there with parks and recreation and housing and transport and all the other things that hopefully good city governance does. And we're going to staff this new peacemaking office with formerly incarcerated community members who've gone away to prison, sometimes for 20 or 30 years, for crimes they committed and have returned to the community. And many folks do return from prison to their communities, and some come back with skills of healing, of mentorship, of conflict resolution, of things that can be great assets and insights, particularly to speak to young people about how to avoid the life that they had as young people now in their 40s and 50s, young people in their teens and 20s. And these are now called what we call neighborhood change agents. These are street outreach workers who are city government employees who work every day to interrupt gun violence and identify those who are at the center of gun violence in the city of Richmond and engage them in what we call the Peacemaker Fellowship. This is the programmatic work of these outreach workers, and they're paid every day to do all of these things you see here on this slide, one-on-one engagements with those at the center of violence. So very much like community health workers, promotores around violence. One of the key things that they do, which relates back to the keynote speaker, is interrupt social media conflicts. Many of these young people, these are young people in their teens all the way through their 30s, are very much influenced, as we just heard in the discussion, on social media. They're posting. Those lead to face-to-face conflicts, not just in schools, but on the streets with guns, and can become quite violent. They do a whole host of other things here. I'm not going to get into all the details, but they do both individual and group healing sessions. They work with communities. They give these young people who get into this Peacemaker Fellowship program opportunities to develop life skills, to develop job skills, to eventually get jobs, to get education, to get the healing supports, sometimes mental health, physical health, food, housing, basic needs that many of them lack, and to repair relationships that are often behind the violence. These are often turf wars that have been going on for generations. They're not driven by drug dealers, and they're not driven by the romanticized violence you see on American television. These are urban conflicts around territory that are beefs that have continued for many, many years. They're rival groups that are sort of at war in our urban neighborhoods. And so street violence interruptions, social media interruptions, and face-to-face, one-on-one and group adults, healthy adults, mentoring these young people for 18 to 24 months every day, day and night, to turn their lives around from being involved in gun violence to peacemakers and peacekeepers. Some of our research has really identified the challenges of this work. So you may have heard of the adverse childhood experiences, the ACEs, those traumas that young people face that really can contribute to lifelong challenges and poor health outcomes and real community health challenges. We found that over 62% of the participants in these programs have 4 or more ACEs, which is really the threshold to really lead to lifelong challenges. And even in that categorization of ACEs, the adverse childhood experiences, there's no mention or there's no documentation of exposure to violence, particularly gun violence. And so we also asked questions about their background in exposure to gun violence. And maybe as no surprise, half of them, or a little under half, had both 4 or more adverse childhood experiences and 2 or more gun violence exposure. So these are highly traumatized young people without the cognitive and decision-making skills and analytic skills to interpret violence, to interpret an insult. Um, they need healing supports, not to be arrested and thrown away for life. And again, I mentioned the importance of mediating social media and interrupting violence on social media. And that's a lot of what these outreach workers do. And we're not, as I think the previous speaker really mentioned, in community health well, I know it in our public health universities, we're not doing much training to prepare the next generation of public health leaders on how to engage with the impacts of social media, particularly on young people and on violence. The stress, the depression, the disconnection, the mental health, and then the related physical health challenges that social media can contribute to. And really the street dynamics of violence have radically changed with smartphones. You know, what used to be a tag, a graffiti tag in a neighborhood is now a social media insult or a live post on Instagram or whatever. And this is what we call internet banging that used to be gang banging, but it's now on social media. And it almost always contributes to real face-to-face violence between actors in their neighborhoods. So these outreach workers are doing this interruption. They're asking different questions. They're engaging young people, again, doing one-on-one and group supports, implementing this Peacemaker Fellowship. It's been going now since 2010 in Richmond, California. It's now spread to multiple cities around the United States. These are some of the outcomes we found with the participants in this program. Almost all are alive, no new gun injuries, not arrested, and have a new life outlook. And probably as or most importantly, we've seen firearm homicides and non-fatal injury shootings go down dramatically in Richmond, California. Again, I mentioned ninth most violent city in the United States, top 15 in the world, now not even, thankfully, in the top 150. And just in 2023, 2 years ago, Richmond had its lowest ever recorded number of gun homicides and shootings in the history that they've been collecting these data. Like I said, this program now is a program called Advanced Peace. It's spreading to about a dozen cities across the United States, and including many cities in Europe and Latin America are looking at this model and are doing similar things to partner. Now, I mentioned that we also need to focus on place. So Richmond also had a lot of decrepit, declining, challenged built environments, abandoned buildings, lack of access to physical safe space. And one was a park in a very impoverished, uh, disinvested in neighborhood called the Elm Play Lot. And this is what it looked like 20 years ago, just a kind of generic place that was taken over by drug dealers and violence, and really was not accessible to the community. The community had really turned its back on this public space, although it was in what we called the heartbeat of this community, right in the middle of this Iron Triangle neighborhood, a formerly and heavily industrial area. And young people said, we're going to take back this neighborhood. They organized. They did door-to-door sampling. They did a photo voice project where they took pictures and narrated their community and came up with a temporary, low-cost, what we call pop-up park. This was a idea of um, could we build a park, our vision for the future, but do it without any resources because there were no resources to build a new park or to revitalize their park. So they got recycled materials and started to redesign it themselves, and then invited young people, kids and elderly to come, and they watched how people used and moved through that space, and then took ideas that they received from users and kept redesigning this in a pop-up park. This is a technique that's now used or has been used by landscape architects to design parks around the world and Latin America and create safe streets and all kinds of things, traffic calming, where we do temporary interventions, look at how it does or doesn't impact behavior and safety, for example, and then make it more permanent. And that's what happened. And they eventually came up with their own design. And this is what we would hope to do in community health, is that the community leads and creates or co-creates with professionals a new intervention. And we're really happy about that in community health. And we say, okay, our job is done, and we go on to the next project or maybe evaluate the impacts. What's different here in Richmond is that the community members demanded that they now build that park that they co-designed, that they learn the skills to construct it, physically construct and weld the materials, that they redeveloped a structure on the park to turn it into a small community center and a public bathroom and a community kitchen that now serves thousands of young people free meals every day, creating hundreds of jobs, putting millions of US dollars back into their pockets through wages and investments, and full-time staff now operate and program that park. This is a city public park, but it's community members are now the staff. They run the programming for young people, for elderly, day and night and weekends. And this is just what it looks like today. Very beautiful, dynamic park. And it's hard to see, but in the background, those boarded up houses and the community that had literally turned its back from this park is now redeveloped and opened, and many community members getting access to affordable, safe, and improved housing around this. And this is not a park project. This is not a playground project. This is a community and human development project. And that's the difference of what's happened here in Richmond. We at UC Berkeley had the opportunity to do a longitudinal study over 10 years to visit the homes and do surveys in 2009 and 2019, 10 years later, to the same households, asking same questions about how you feel about safety in this neighborhood and park use, public space, access to, do you know your neighbors? Would you meet with them? Things like that. And this is what we found from both the gun violence and this Pogo Park community project. Incredible, statistically significant increases in people saying they know and trust their neighbors. They're willing to now have friendships in their community and go to somebody's house if they need something. And reductions in people about self-reports of poor mental health and of experiences with gun violence. So again, this combination of both focusing on people and place, we think is a healing solution and a healthy part of this healthy urbanism. We've also seen a 5-year improvement in life expectancy in this neighborhood for a little over 15 years roughly change. So let me wrap up there. I know I'm probably over time, and hopefully take some questions of, what does this work look like in practice? Who are the partners? What are the methods? How do we really take what seem like intractable problems of violence and disinvestment and really poor health outcomes and make some progress, really change things in a relatively short period of time? Well, part of that, in our experience, is centering community knowledge and local culture, not to romanticize that, but to deliver really tangible life affirming supports. We've heard about a lot of this notion of misinformation and disinformation and distrust of public health. I think part of that is to recenter community knowledge and community experts, whether it's the formerly incarcerated folks from the gun violence program or those in the community who were capable of redesigning and rebuilding and now managing local public space. Ask what makes places and people healthy and happy, rather than in public health, we're too often asking, what are the diseases and problems here, and focus on deficits rather than how do we lift up those assets. And in every community where I've worked around the world, there are assets to build upon. Social connection, we found, is still the foundation of health and healing. All of what we do in medicine and all the great technologies and innovations we've had, we still come back to the foundation of health and healing in our communities is social connection and face-to-face, not online supports. And ending violence is really a key to community health. There is no community when there's violence. Again, like I mentioned, fear, challenge, there's no public realm, there's no education, there's no sleep, all those things. And we must co-create solutions even with those most impacted. The gun violence program centers those young people, and they are leaders and they become leaders in their own community in creating and keeping the peace. And that's what we call neurourbanism. It's both people and place centered. It has to focus on and with a deep understanding of the stress response in our bodies and how we reverse that and can reverse that using these sort of tools of social connection, of improving built environment, and that highly, highly technical scientific term, ultimately, of love. That's the one that we've seen has been most influential of people really coming together and seeing their common humanity and lifting up their neighbors. So I'll stop there.